mic. So usually when I come at the end, there are a lot of people who want to ask questions on a personal level. Happy to do that today as well. If after the talk, people want to ask, you don't want to ask openly. So I thought it might be a good time, because usually when I give my talks, it's usually the talk and only a few minutes for any questions or discussion that you want to have. So today we thought we'd have an open session, so you can ask questions, about anything to do with older person's mental health, and dementia, as you know, is becoming an increasingly big topic. So one of the things that I do is to write little booklets for the faith community, for lay people. And this is my third one, which has just been printed, because I get it printed in India. It's so much cheaper. So I can only bring copies when I come back from India. So, so unfortunately, I don't have many copies. I can give 2 or 3. I'll give Pastor Jeremy one. But I have now, so that it can be distributed widely, all the booklets, it's on an e-link. Yeah? So if anybody is interested, I'll tell you my email address, and you write to me, and I can send you the link for all 3 booklets. Yeah, I know older people, including me, I'm also old, don't like to read very often on computers and phones, prefer to hard copy, but at least it'll give you an idea, you can read. Okay. So this one, the latest one, is called Older Person's Mental Health and Dementia from a Christian Perspective. Okay, so that's what this one is. So I said I'll give a copy to Pastor Jeremy, and you'll have one here in the church that people can use. So, so as I said, I'm open today. Let me just, sorry. This can be put up, isn't it? Can it be lifted up? Or is that the maximum? Maximum, yeah, that's okay.
Bring the pulpit. Bring the pulpit more stable.
That's all right. If you can't, it's okay.
Bring the pulpit more stable.
I think max. That's all right. Yeah.
More stable.
Okay. Doesn't matter. So, just as an introduction, before opening it up for people to ask questions, older citizens are, as you know, special people. I consider them people. I'm also an older person now. You know what's the sort of age range medically? Oh, thank you. That's sorry for the nuisance.
You have to hold it like here.
Yeah.
So that
Okay. Thank you. That's much better. Right. Can you hear me?
Yeah.
Told I should hold it nearer. I've got a fairly loud voice, so I try to keep it away from. So the definition, very often medically, that we have is anyone from 65. That's a retirement age in Australia, isn't it? 60? 7 now. Lifted. Yeah. So it's going up. And when my father used to work in Singapore, you know what the retirement age was at that time?
55.
55. So he retired at 55, and wanted to go back to India, settled in India. So now in Singapore also it has gone up, isn't it? The retirement age. So as we develop in India, it is still around 60. But 65 is what is used here when it comes to medically. Between 65 and 75, we say young old. Right? Young old. And from 75 to 85, we say old. Right? And 85 onwards, we say old. So you get that? So you can all I don't want to ask your ages, but you can all decide which one you are, young,
Yeah.
old, or old. So I am now in the old group, not the young, old. So many of us sitting here, for there are a few who are probably not in that group. Most of us are in this group. So older citizens are special people, right? And parents very often, they've been grandparents now, and veterans who have been in the war. So they've done great service to families, to nations, and we have to respect them. Yeah. So they brought us up, our parents, contributed to the nation building in some way or other, and suffered, many of them. When you talk about old people now during the war times, they suffered a lot. I know my father, for example, my parents, how they did suffer. So suffered and sacrificed. And it's our turn now to look after the older people. And a part of the aging process, fortunately, unfortunately, that's the way God has created us, we become frailer. Yeah?
Yeah.
Is that right? That's why we have to do all these exercises to keep ourselves fit, because we get frailer. And we get frailer physically and also mentally. We get frailer. That's part of the aging process. And we become also, because of the frailness, more susceptible to diseases of the body and physically and mind. Body and mind, we become more susceptible. And also the way we have been created, we have not been created, we talk about the body, the soul, which is, the soul is the intellect, the emotion, the will, right, and the spirit. That's the way, that's what's called the tripartite theology, of man. Not everybody, some people think about the bipartite, only body and soul. But this is body, soul, and spirit, is what I look at it. And the way that we have been created, even though we talk about the body, soul, and spirit, we are not created like compartments. We function as a whole, yeah? And because of that, if we have diseases of our body, it affects our mind. And if we have diseases of our mind, it affects our body. That's the way we have been created. Yeah? So mental state can be therefore impacted by physical illnesses very often, and by medications that are prescribed. And the unfortunate thing is, as we get older, what happens? We get more and more medications. Is that right? No, many, when I was working with Lacey, used to work with me in Peter James, many of the patients who used to come to us had a whole load of medications. Many. And one of the first things I would tell my registrars is, cut it down as much as you can. Cut it down. Because every medication has got exactly. And we become more susceptible to side effects as we get older. You see, let's say blood pressure, we got blood pressure. Many of them, as we get older, we get blood pressure. Yeah? We put on blood pressure tablets. And then very often, many of us are not on just one, we got two. Some even three blood pressure. I don't know why. Yeah. And what does it do? It lowers our blood pressure, and it can give rise to what's called postural hypertension, which then can affect our brain, causing defects to the brain, because blood pressure is not going, the blood flow is not going as much to the brain as it should. You understand? And unfortunately, many when you go to many GPs, they'll think, oh, we need to keep the blood pressure between 120 and 80. That's not right. As we get older, our brain, the blood has to, because our blood vessels are getting thicker, we need a higher blood pressure to get the blood into our brains. You understand? So the the blood pressure levels that are acceptable should be higher, rather than trying to reduce it drastically with blood pressure tablets to a point where then it causes further. Okay, so just a few thoughts there. And just another thing, the population of people age 65 and over has tripled over the past 50 years. Has gone up 3 times over the past 50 years. Are you with me? Tripled over the past 50 years. And it will triple again in the next 50 years. Right? And by 2050, not very far from now, 2050, 2.1 billion people will be aged over 65 and over. And what is happening, you all know, isn't it? Japan is becoming such an old country, there are very few young children now being born. The country is becoming aged, right? And many Western nations, the same thing is happening, and that's why many Western nations are having immigration to try and get younger people here to do all the jobs and look after. So this is happening. It is happening in Singapore, right? Less children being born. That's why they have to get more people. So it's happening everywhere in developed countries. People are living longer, yeah? So the fastest growing proportion, do you know which is the fastest growing proportion of people in the world? People over the age 80 and over is the fastest growing population. My mother is 97 in India. And last year she had a stroke, and we thought that would be what's going to end her or going to make her debilitated. But she's such a strong, resilient lady. She has recovered from that. And she was, before she had the stroke, she was the one in the kitchen doing all the cooking for us. And now, after the stroke, she wanted to go back to the kitchen. And we said, no more, You're now on blood thinners, and you cut yourself accidentally, you're going to bleed, and you fall, and you just had several falls, you're going to have, bleeding in the brain. So, fastest growing proportion is people over the age of 80 and over. So with the shift that's happening, older people will overtake infants as being at the greatest risk of disease and disability. Because usually we think, infants, the little babies are the most susceptible to diseases because they have not built up the resistance, built up all this. But now it's going to be the older people in our community that's going to be the most susceptible to diseases and disability. Around 14% of adults age 60 and over live with a mental disorder. And the most common conditions are, you know what they are in the older people? Mental illness? Sorry? Depression is the most common. We think about dementia. The most common mental illness in older people is depression, anxiety, dementia. Yeah? And globally, around the whole world, 1/4 of deaths from suicide are persons over the age of 60. People don't really often think about it. 1/4, 25% of deaths by suicide all over the world are people over the age of 60 plus. Okay, so just a few demographics. We can talk, come back later. Now I want to open the thing for you to ask any questions you have about older people, mental health, depression, anxiety, dementia, whatever. What if I can answer, I will. We can all have a discussion. Yeah. Those were a few things to start you off on the discussion. Yes.
Dementia among senior citizens, is that because of environmental or living conditions that's induced, or is because of a purely chemical imbalance in the brain or body?
Okay. Dementia is what we call a common a term that involves so many different things that's happening, yeah? So there's not really one type of dementia. There are many, many different types. I often say there are 101 causes that you can have dementia. Okay? So dementia is a broad term that's happening where the brain is showing degeneration. But the most common cause that people often think when you talk about dementia is what's called senile dementia of Alzheimer's type, Alzheimer's dementia. That probably accounts for 50 to 60% of people with dementia as you get older. And you see, often we think about dementia and old age. But the interesting thing is senile dementia, dementia, what's called the Alzheimer's dementia. Initially, you know why it's called Alzheimer's? Because, anyone? No? The man who first discovered was called Alois Alzheimer. Okay, that was why it's called Alzheimer's dementia. Now, when he first described the illness, it was in a younger group of people. So Alzheimer's disease also has also pre-senile, senile. So it is initially described in younger people, this disease. So then it was found more common when they began to look into it, it's more common in older people, right? So that's senile dementia. Now, there are so many other types of dementia. We call reversible and non-reversible. So reversible causes, for example, are things like vitamin deficiencies, right? For example, vitamin B deficiency. If there is, it can give rise to a dementing picture, but that is potentially correctable. Yeah, if you try. Similarly, some infections and diseases can give rise to a picture of dementia, which can be potentially reversible. That's why I said there are so many different types. And in the what's called the non-reversible or degenerating dementia, Alzheimer's is the most common. The next most common is due to strokes that happen damaging the brain. Yeah? So stroke is when a major blood vessel gets blocked and then you get the paralysis. But what can happen is the process can be happening over a number of years, causing blockage of little blood vessels in the brain, which you might not have any major paralysis or weakness of any of your limbs or speech, but it could be affecting the higher functions of the brain, giving rise to memory problems and other problems that happen in dementia. So that's the most second most common. Alzheimer's is the most common. Stroke is due to a vascular cause. Then we have so many others. Parkinson's disease. You know, Parkinson's disease we often think about, we hear more and more about that. It's a dementing illness. But what happens is that in the initial stages, the lower part of the brain is impacted, and that's why we have all the movement disorders. But as the disease progresses, the disease begins to affect the higher areas of the brain, giving rise to all the memory problems and confusion, speech difficulties. Huntington's chorea, you might have heard, is a dementing illness. There are many toxins that can give rise to dementia, right? Things in the what we're drinking, nothing is pure these days, yeah? And that can give rise to dementia. So I'm just giving you, I don't want to go through all, there's so many different kinds of dementia, causes of dementia. And so it is what we often think when we talk about dementia is the Alzheimer's type of dementia. Now when we come to Alzheimer's, so does it answer the question? So it depends on what the cause is and what's happening to the brain. So if it is Alzheimer's, which is the most common, yes, what is happening is, you can talk about genetic. What has been done is when people have looked into family history, they have found that there are in some families there seems to be a genetic loading towards dementia. But in other families, they have not found the link at all. They have not found any history in the family of anybody. So as a single reason, we can't explain it on genetic basis. Okay, so it could be, unfortunately, these days we know that many of the diseases that we talk about has a genetic root. Is that right? Diabetes, blood pressure, everything. We are left with weaknesses from our parents, grandparents, many of the diseases that we suffer from. So there could be a genetic root. Then what is happening that we know is that there are changes in the brain. How does it function? It is by what we call neurotransmitters, yeah? Chemicals in the brain which pass messages to the hundreds and thousands and millions of nerve cells in the brain. And some of these chemicals, there is a deficiency, which then gives rise to the problems that we see. Now, there are a lot of theories as to why this is happening. We still do not know for sure. And so much of the current emphasis on trying to correct this deficiency by giving different medications. But again, you hear suddenly, oh, we've got to find a new treatment, but nothing has definitely. It might reduce or slow the process, but nothing that reverses once you have Alzheimer's so far. Any other? Yes.
Yeah, depression. Can you tell us what are the main causes for depression?
What are the main causes?
And how we can overcome it?
Right. So, again, let's concentrate on our older group. What do you think are some of the main causes of depression in older people?
Loneliness.
Sorry?
Loneliness.
Loneliness, yeah, is a major factor. As we get older, we become more and more isolated, and that's why groups like this are very important and very good. Many old people just get isolated, and that could be a major factor for depression. What else?
Illness.
Sorry?
Illness.
Illness. Good. Yeah, very deeply, okay? I remember that. Originally.
Malaysia.
No, your profession.
General practice.
Yeah, I thought I remember it from last time. Yeah, so, sorry, you were mentioned again, sorry? Illness, yeah, we talked about all kinds of physical illnesses which can give rise to depression. Okay? Anything else? Sorry? Stress, yes. Stress causes, we are living in a world of all kinds of stress. Stress can give rise to anxiety, which can then go on to depression. Yes? What else?
How about diet?
Diet, yeah. So, diet and lack of exercise. Diet by itself may not cause depression, but it's important. Diet, exercise, etc., to try and prevent us from going into it. But yeah, diet, yes, from the fact that there can be some deficiencies of some vitamins, etc., which can give rise to depression. Yes, sure. What else?
Loss of spouse.
Grief and losses in life. Yeah, loss of husband, wife, loss of children. As we get older, we are at an age when we are going to lose more and more people. But loss is not only of people, it can be of property, it can be of finances. Yeah, so financial stress is a big factor in many old people. Job, many in the world, work has been their primary focus. And they have never planned what's going to happen after that. And once they retire, it becomes a major factor. They have lost a purpose in life. They become useless. They feel that they are now on the scrap heap. Nobody wants them. They have become useless for society. And that could be a factor. What else? All right? Health you're talking about. Is it health? Yeah, sure, absolutely. So, and when you talk about health, which is a major factor, that number of illnesses, not just one. Many, as we get older, we don't have just one, we have got multiple illnesses, yeah, which can cause. And severity, how severe it is, the more severe it is, the more possibility of it becoming, causing depression. And neurological disorders have got a higher incidence of depression. That means it is well known, for example, people who have had strokes, they are much more vulnerable to depression. Okay, so neurological, Parkinson's, much more vulnerable for depression. Okay, so not only, all physical disorders can increase, but mainly more neurological disorders can have extra reason for depression. Disability, nobody mentioned that. As we get older, we have chronic pain, arthritis, etc., which then again causes us to be more isolated, causes chronic stress on our body because of the pain and arthritis, etc. And then also psychological, we feel now we are becoming a burden on others, our families, our children, our others, and that could be a factor as well. I don't have to mention to this group, but alcohol abuse is a big factor. As people get older, if they've had the tendency, they drink even more, and that could be a causative factor, a contributory factor for depression. Prescribed medications. Prescribed medications. A number of the medications that we are prescribed can contribute to depression in older people. And when studies have been done, I'm not going to list all that, about 22 different medications that are prescribed have been noted to have a contributory factor. Okay? So that's why I was saying about, as we get older, we are prescribed more and more, we have to be careful, yeah, about the amount of medications that we take. Some of them are absolutely necessary, but we have to always look. And we get older, that's a tendency. Okay, so that's depression. Any other, some of the causes of depression? Anything else?
Just now you mentioned about vitamin B deficiency.
Yeah, that's one of the deficiencies.
And vitamin B, there are like so many range, so many vitamin from 8, 1 to 10, or 1 to 12, and all these things. Now, what kind of vitamin B, like vitamin B1 or B2 or B3, which one would you recommend, or maybe, and what food to eat, to
Food. Yeah.
Vitamin B rich food.
I mean, look, I do not, we should probably ask our GP brothers, I do not, again, advise, very often we try to take nutritional supplements. And as we get older, we spend a lot of money on nutritional supplements. At one time I stopped taking all that. We don't need that. We don't need that. If we have a good, well-balanced diet, we'll get all the vitamins. Many of the vitamin supplements that we take are just secreted from our body. Okay? It's useless. So unless there are problems where we go to a GP who does an investigation and in the blood says, oh, you are lacking that and you need for some kind of supplement, that's fine. But otherwise, I would not advise all the supplement. And sometimes what can happen, it can give rise to toxicity without us knowing, right? Many of these vitamins. And that can then give rise to all kinds of physical and mental problems as well. Do you agree, brother?
Yeah.
Yeah. Yeah, please feel free to, into that.
I guess first and foremost.
You want the mic? Yeah.
As with regard to your question, first and foremost, because it's such a small field of medicine, that people will look into it, study it, research it. So there's not really a specific answer can give to you which vitamin B, because basically it's all lumped together, B complex. First and foremost. Secondly is the impact on your health really depends on a lot of other factors as well. And it's very difficult to say it's because of vitamin B1. If to establish a certainty, you need to have a big group with a few thousand people taking vitamin B and then develop a certain particular disease. So your question is an open-ended question. There's no definitive answers. And as Dr. AJ has mentioned, if not necessary, don't take it. If you need to take it, don't have specifically take one particular type because it will be high potency. Normally, in normal vitamin, they only supply you half of the daily intake. So you're taking all those things because from vitamin A to Z, there's so many of them. So each one of them, you only get microgram. But if you take vitamin B1, you're talking about milligram perhaps. So there's a high dose. So normally you take multivitamin. Then you're not missing out. You take vitamin B, you're so high vitamin B, like your zinc or whatever other vitamins. Then if you say, oh, then I found like in zinc or vitamin D, I start taking that, and a high dose of every one of them.
And can become toxic. I mean, I said I stopped some years ago, but the only thing that I take is, what do you think I take? I'm a dark-skinned person. That's right. So every time I go, I find my vitamin D, the GP says is low, so I've been advised. So someone with dark skin is much more vulnerable to low vitamin D, and then that as you get older, you can get osteoporosis and all that. So that's something that I'm taking. Yeah.
Now, vitamin D is an interesting question. As we age old, because vitamin D, first and foremost, is not present in any food except egg yolk. And then a lot of people shy off from egg yolk because of cholesterol issue. Actually, it has been said, actually stated by the egg board. We saw it in our medical paper. Egg board put out advertisement. The cholesterol in the egg yolk actually have good cholesterol.
It's good cholesterol. That's right.
Yeah. Secondly, a lot of us have cholesterol issue not because of the food we eat, but because we are the producer from the liver. And by and large, this is true. But then there, of course, there are some people who absorb, cholesterol. I have a patient who suffered from high cholesterol, and then she stopped taking eggs. But then I told her the egg yolk is good. She started taking the eggs, and then her cholesterol started to come down.
Yeah.
So that's one thing. And the other thing also, vitamin D, we get it also from sunlight.
Yeah, that's it.
Light.
Yeah.
So a lot of us, if you go out often enough, you have vitamin D. Except high pigmented people like KG and African, because you already get so much melanin blocking off the UV ray. So we expect the Indian to get so much sun, they should have high vitamin D.
Yeah.
But just the opposite, because they have high pigmentation, they block off. Whereas we, olive skin or the brown skin, we can still absorb some.
Yeah.
Whereas for KG is the block off the UV.
That's
So
right.
usually,
And especially when you're staying, in the Western countries where you don't have much sun.
that's right. That's
You-
also.
And the other thing is, have you noticed when the Western people, white-skinned people, go to the beach, where are they? All out in the sun. Indians, when they go to the beach, you know where they are?
Become
Under the shade, under the
Chinese
trees.
also.
They don't want to. So you're not getting enough sunlight.
Carry umbrella.
Is it?
The sun come out from your house. The sun already.
But then these white skinned people have problems with skin cancer.
Cats, that's right, yeah. So that's why you need the
Very
balance.
contradictory.
You need the balance. Yes.
I have a question for
Yeah.
Frank here.
Yeah.
I watched a program on ABC about the danger of vitamin B6 in B complex, and it causes damage to the nerves in the foot and legs. One of my relatives actually took vitamin B6, that's her experience, and she has numbness in the feet. Would you like to comment on the excessive danger of vitamin B6?
Actually, vitamin B has been said to be beneficial to the nerves. But of course, like everything, if it exceeds the tolerable level, it will become toxic. For instance, vitamin A has been pretty commonly consumed by people, especially white people. And it was found out from one patient who suffered a very peculiar disease, and they couldn't find anything. And then they look into, her daily life and whatever she takes, the supplements, and then found that she take a high dose of vitamin A, about 5 or 8 tablets a day. So finally, they found that vitamin A overdose, toxicity. And from now on, you can never buy vitamin A. It has to be combined with other vitamins, which means that you don't get overdose. Because by taking a single tablet, as I mentioned just now, you're not taking milligrams, you're taking about grams, something like that. So it's the same with vitamin B. On the one hand, it's beneficial to the nerve, but then if you take vitamin B1 or B6 by itself, it's high dose. So you over the dose, over the toxic level, because all along we only study what vitamin is good for you is within a certain range. But no one went out of the way to say a lot more than find out the disease, because they only want to sell it. They want to sell and make sure everybody is safe. So they know that what is our body intake. So they may just half the dose or maybe a bit more, but never give. But if you take 5-6 tablets, of course, out of the range of research, of course, then you have to expect some toxicity.
Yeah. But, I mean, that's at the end of the day, I would say again that it is concentrate on your diet rather than take. There's high reason now, you have seen news about people with toxicity, as you're saying. That's a risk of that. If you do a good, well-balanced diet, you don't need all this. Apart from if you are showing symptoms that you go to the doctor, he does tests and tries it. There was a question there?
Maybe can we keep the questions more to today's talk is about mental health for seniors instead of being a bit diverted.
Sure.
Yeah.
All right.
I have one question for you. I think as we grow older, many of us may feel terrified of being useless and of all the indignities of a failing body. We can be terrified of death too, even though we believe in heaven or as a Christian. So how would you maybe advise us on how do you finish life and finish out the final unknown stretch of this race without being increasingly terrified of all these things?
Yeah, I mean, that's a good question for all of us. It's not mainly for a mental health professional. I mean, I think as a Christian, we have probably compared to people out there increased tools as a Christian. The Word of God, these fellowship. I mean, it's been found that faith communities, people who have got a faith, are more resilient. Why? Because we can trust the Lord, we have the Word of God, but also these kind of communities, the churches, those kind of things keep us much more resilient and hopeful of what God has said. I mean, at the end of the day, it is not only older, in every aspect of our life, isn't it? How we translate what we know in the Word of God to our daily life. It's always a challenge, yeah? And all of us differ how we can do that, our faith. We can read the Word of God. How do we put it into practice is a challenge that we all face every day. I do not have a solution for that. A one-word solution. I think it is. It's a constant, daily challenge. Life is a challenge. Life is a challenge. God has not made it easier for Christians compared to non-Christians. But what we have is the Lord and our faith that we can depend on every day, and saying, even in the worst circumstances, what God has said is, we're not going to take you out of this problem. Anywhere in the Bible, it has never mentioned. Even Psalm 23, even though I go through walk through the valley of the shadow of death, I will be with you. That is what God has promised all along. That He is with us. Not going to take us off, He's going to be with us. And as Christians, what we can do for those who are going through all this is to be that as well. To be with them. We are, very often we want to go and solve their problems. But what many people want is someone who can walk with them. Yeah? And that's when we're talking about caring of people who are going old, is that, visiting people in the nursing homes. You see, nursing home, we've talked about depression. The other, we talked about various reasons for depression in older people. We talked about losses, loneliness. Another is about moving to a nursing home. Lacey is here, she'll tell you. You go to a nursing home, there's a higher incidence of depression in people in the nursing home compared to the, many of them feel they never wanted to go into a nursing home. They're trying to come to terms with that. It is a loss for them, their life. So there's a higher incidence. So can we, for example, as a group of people in churches, have these, it's great having this group here. Many churches don't have that, groups for older people to care for them. But can we also have little visiting groups to nearby nursing homes to try and support them, look after them? There's a challenge, for churches that I like to put, can we have these kind of teams that just go visit people in nursing homes and support them? It'd be great if we can do that. So in answer to your question, I don't think I've got a simple solution. It's our faith, like in every area of our life. The same thing comes to when we get older. We know all the theory. How do we put into practice? It is a daily challenging walk with God and knowing that God has promised to be with us whatever we're going through. Any other questions? Yes.
How to apply for HK?
Lack of vitamin M.
Yeah, lack of vitamin M. You're talking about dementia, Alzheimer, and all this. Alzheimer. We are talking about losing of memory power. So a lot of people, like us, we tend to try to do some activities for prevention. Like some people play mahjong. Some people have all those number games on this thing. Does all this thing help now?
Yeah, it does. And just like we talk about keeping ourselves physically active, which helps, when we talk about one of the common problems is arthritis as we get older. The more we keep ourselves physically active, it reduces the, not saying it's going to stop it, but it'll help us to delay it, or even when we have arthritis, very often the tendency is to just sit back because it's painful, difficult, but the more we do, even though it might be a struggle, it helps. Right? Similarly, when it comes to mental health, the more we do, so it's been found that that people who know more than one language could be a protective factor for dementia. People who have musical talents, musical instruments, could be a protective factor. Okay, so the more we keep our minds active, reading more, right? Playing games that challenges our brain. Every morning I do a chess puzzle on my phone to try and keep, and I do obviously reading, writing. So the more we keep our mind active in whatever way we can, reading newspapers, reading, now these days everything's on the computer. I think more reading that we do rather than just listening, it will help as well. So in answer to you, yes, the more we keep our mind active, that could be a protective factor. I'm not going to say that that's going to stop us from having Alzheimer's, because if that is, but it will delay or it will help some of the types of dementia. Yeah. Any other? Yes.
I'll just supplement a bit of information in addition to what you said to the question. I suppose in general, yes, if you try to activate your brain and do something, learn new things, you improve. Provided, because we know that there's a multitude of causes of dementia, from, let's say in general, 1 to 100, and you only address one, and the overriding cause of the dementia is something else, you will find that the benefit is minimum. But then if you're leading an average life, good diet, good sleep, good control of blood pressure, and control of your body weight, and your happy life, happy marriage, no family problem, no family issue. Yes, there is a general vascular or old age dementia. So you start using your brain a bit more, activate your brain, so more brain cells being activated. Some of the neurons, some of the brain cells that has not been used will start to be activated. Yes, you'll find market improvement. But then if for instance, your dementia is caused by alcoholism, yes, you learn this, but you keep drinking alcohol. So you find the impact of whatever you're doing is less effective. Rather than you say, oh yeah, this in general, as Dr. KG mentioned, yes, improve a lot of us here because we are non-alcoholic, and then we are leading an average life, we are active a lot. Yes, this will make a great improvement. But then if you find that you are in a situation where you have a lot of other factors, if you only focus on one, the impact will be less.
Thank you.
I have one question.
Yeah, sure.
How can we go about helping people who are in depression?
In depression, yeah. So we are not professionals. Good question. What can we do as lay people? Some of the challenges that older people have, when they're going through depression, when a person is going through, is difficulty talking about their thoughts and feelings. Am I right? Older people are usually much more, they don't want to show their vulnerability. And as Christians, we are probably, if I say that there's something wrong with me, people will think I don't have a good faith. You're a Christian and you're talking about depression. It's good for us to ask people, are you okay? How are you going? In Australia we have what's called an Are You Okay Day, once a year. Yeah, it is one of the first things that we need to realize. It's okay not to be okay. It's okay not to be okay. And we cannot get any help until we accept that there is something wrong with us. Acceptance, I always say, is the first step. That I am going through this difficulty. I am going through depression. I am going through anxiety. I need help. And so older people find it difficult. They are often ashamed. They have got discomfort. They have not been brought up in a culture. I wasn't brought up, I'm sure many of you, in Asia, we don't talk about our feelings, do we? We talk about other things. We talk about our studies. But how many of us have been brought up? My parents didn't talk about, how are you feeling? Never ask that question. Yeah? What is going on? So we have been brought up in that culture, especially more so as Asians. We're supposed to be stoic. So people find they're ashamed, they've got discomfort, fearful of being a burden to the family. That they'll be misunderstood by the younger generation. Stigma of the mental health, that as a Christian we should not suffer from mental health. So how do we help? First of all is engage with the older person. If people come for a group like this, in the group we can have the group activities which are good, the exercise, the socialization, but do we try and get engaged with one or two? That's the only way we're going to form that relationship. Engage with the older person, especially if you're worried about them. You see, they look as though they're not their normal selves. They seem to be a bit more flat in their affect. They seem to be a bit more anxious. They're not coming for the groups. Do we go try and make contact with them? Engage with the person. Secondly, then choose the right time. Not every time you see them in a group like this might not be the right time to talk to them. Choose the right time and place so you can have a conversation with them. Make sure that the person knows that you genuinely care for them, right? You're not doing it, because I'm a church elder, this is my responsibility. People will pick it up, right? That you're not genuinely caring for them. You really have compassion, the way Jesus had. keep reassuring them that you're wanting to assist them and not to interfere. Where your people might feel they're trying to find out all these questions, so they want to interfere in my life. Appreciate what they're saying. No matter how small a thing, appreciate what they're saying and show the concern. If the person is emotional, beginning to cry, just sit with them and let them know that it is okay to get upset and even be tearful. No harm in that. Jesus wept. Try to understand. What is that? Listen with empathy and understanding. You know the difference between sympathy, empathy, yeah? You know that, isn't it? Sympathy is just feeling sorry for someone. Empathy is trying to feel the way that person is, what he's going or she is going through. Trying to, not just saying I'm sorry, but trying to understand. And compassion is what we're doing now, trying to do what we can. And not jump, very often that's our tendency, with pat answers. This is a solution, right? We are not professionals, right? We are lay people, so don't jump into pat answers. People just want you to listen, not to give pat answers or solutions to what they are going through. If a person is reluctant to talk, try to understand why and be patient. Talking about anxiety and depression may not happen immediately. It takes time until you form that bond. If talking about emotions is difficult, then change the focus to something else that they can talk about. Let the conversations flow naturally and not artificially. Check that you have understood what the person is saying. So sometimes it's good when you have to, is this what you're saying? Is this what you're meaning? Trying to reflect it back to them. Yeah? Use words that have meaning to the person instead of saying you're sad or depressed. And offer assistance without taking away their independence. So this is some of the things that we can do. The other things that we need to do is, if you find that somebody is depressed, check that the person is safe. What did I say about suicide? Older people are much more vulnerable to suicides. And don't think because he's a Christian, he's not going to commit suicide. Yeah? We have again this feeling that suicide, if I ask you the question now, all of you are Christians, is suicide sin? Is it? Where in the Bible does it say suicide is sin? Can you tell me?
Thou shalt not kill.
Yeah? That's one of the things that people say. Is that about self or others? We don't know. There's nothing definite say suicide is sin. All right? But that's the one that's quoted very often. So is suicide sin? There are various views. Suicide is sin, that many of you said. Suicide equally, other Christians say suicide is not a sin. The third is suicide is a forgivable sin. We all, when we die, we'll be going to heaven with things that we have still done wrongly. Is that right? And God has to forgive. When we die, do you think all the things that we have done wrong has been set right? No. So, is it a forgivable sin?
Yes.
Or is it an unforgivable sin? These are four sort of ideas that people have when you talk about suicide. Now, why am I saying this? If you're trying to help someone who is suicidal, and if you come with that attitude, suicide is sin, they will pick it up. People can pick up from your facial appearance, the way you're talking to them. People are not stupid. They can pick up. Do you really care? Are they condemning us for what I'm saying? People will pick it up and they will climb up. They're not going to go on talking to you. Immediately they pick up the feeling that you think they are, this is the way you think. So check whether it's safe. If the person has thoughts of suicide or self-harm, they need to be referred. Once a person has got suicidal thoughts, they need to be referred. It's not something a lay person can deal with. You understand? They have to be referred to a professional. And encourage them to then seek professional help, make a plan with a person and offer practical support. Pray with the person and show compassion and respect their privacy. All right, any other, so the question, what can we do? These are a few things that I've listed of things that we can do as a layperson to help somebody who's going through depression, going through anxiety, going through other emotional problems. Be there for them. Any other comments, questions? I would like to,
One last question, anybody?
Yes.
We're going to wrap up.
Is it possible for somebody who is struggling themselves to offer assistance to other people, or
Somebody who is going through.
their own issues? Can
Yeah.
they help others, or is it, they can't because?
Yes, and very often someone who is going through difficulties will be able to understand very often what the other person is going through. So I would not say that if you're going through a problem, you can't help somebody. I mean, if you look at it, all of us have got problems, haven't we? Is there anyone who can say, I've got no problems in this world?
Like if the person has depression themselves.
Yeah. If the person is severely depressed, certainly, you won't even feel like going and helping anyone. Yeah. So, but if you feel that able, even though you are depressed yourself, then by all means do it. As I said, you'll be able to empathize with them better as to what they are going through. So I don't think that would be deterrent. But if you're so depressed, you have no energy, you have no enthusiasm, you don't feel like doing anything, obviously you're not going to do it. Any other before we close? Let me sorry. I'm listening.
Yeah, we know we have all these mental health issues, therapists. How do I know that, there's psychiatrists to go to, psychologists to go to, like?
Counselors, pastors.
But the therapists, yeah. And lately I heard about somatic experience practitioner. So there are so many of them. They need to be referred by GP, or we just go and seek help with this, any of them?
Good question. So, very often when you're going through, you don't know whether we need a psychiatrist, whether we need a psychologist, whether we need a Christian counselor. So, let me just say this. So, one of the things that we have developed at the Center for Theology and Psychology is what we call a directory of Christian mental health practitioners. Because we Christians very often want to go and see Christians when they're going through emotional problems. Only a few psychiatrists, but there are quite a number of psychologists, and there is what's called a Christian Counselors Association of Australia. And if you go on their website, CCAA, you'll find a whole load of Christian counselors near your house, near your place, that you can go. You don't need a referral to go and see a Christian counselor. Now, so if anybody wants this list, you just have to write to me, and I can send you the list. It's for private use, not for publication of this list of Christian psychologists and Christian counselors. Now, coming again to your question, that's one thing that I have, along with the list, when I said, I don't practice anymore. I'm not registered. But one of the things that I can do is listen to you and probably advise. Maybe at this stage you need a psychiatrist, a psychologist, or a Christian counselor. I'm happy to do that. And there might be others who have got experience who might be able to help you as to whether you need that, this or that. Yeah? So that's something that I can do as well, and give you that, send you that list.
What is this somatic experience?
Sorry?
Somatic experience.
Somatic experience.
Practitioner.
Oh,
They
I
deal
don't
with
know.
trauma
I don't know.
lately.
Yeah. Traumatic. You're talking about trauma.
I don't know.
Somatic or traumatic?
Somatic.
Traumatic.
So,
Yeah.
SOS.
Yeah. So they're more they're specialized, like counselors, psychologists, who are specialized in trauma counseling. Those who have gone, as you would have heard of post-traumatic stress disorders and other traumatic. So they are either psychologists or counselors who have got special training to help people who have gone through traumatic experience.
Thank you.
Before we close, can I just closing just say a few things? Is that right? Yeah. As infants, we are all in the older group. We are dependent. We are immature and we are learning. And as we age, we become dependent. Right? As young, we are dependent. As we age, we become dependent, and then we deteriorate and die. We are, as human beings, whether we are young or old, designed to be dependent. That's the way God has designed us, not to live isolated in an island or whatever. We're dependent. Dependence is not the result of the fall. We often think it's because of that. It is part of our creation. And the Hebrew word for Adam is from Adama, the ground. We have come from the ground. We are groundlings. And what does that mean? We are frail, we are dependent, we are limited, we are vulnerable. And created not only to be dependent to God, but to one another. Remember that. We are created to be dependent with one another. And that's why God, after creating Adam, he said, well, it's not good for man to be on his own. Right from creation. That's why he created Adam. So there's no, it's not that you are failed or you are weaker if you feel that you need people. God has placed us in families, including the Christian family, and we are linked together in mutual dependence. We should see old age and aging not negatively, but see it as part of life and not feel guilty of dependence. Even in dependence and disability, we can live fruitful and God-glorifying lives. Unfortunately, aging is seen as negative in many Western cultures, and increasingly so, I would say, unfortunately and sadly, even in Eastern cultures. Hence, we talk about euthanasia, we talk about assisted dying, we talk about this term healthy aging. It's all because of that. Even churches and Christian communities focus on the young people and young families, elderly considered a burden. It's good this church is having this. The Christian vision of human beings being created in the image of God is revolutionary, and it is the basis for caring and the foundation of ethics. Without such a vision, caring becomes more transactional and ethics vanishes. God knew us when we were in our mother's womb, and we read that in Psalms. God's plans are to prosper us. Neurological decline cannot separate us from the love of God and our ongoing vocation as human beings. Lives touched by profound dementia continue to have meaning and purpose. Dementia is a devastating illness causing suffering, lament, and much change, but those people remain tightly held within the memories of God. It is our ideas of what humanness, the nature of self, and self-fulfillment mean that need to be recreated. So I'll leave it there, and so we need to rethink about aging, what old age is, how God views it, and how we can work, travel with, and walk with people who are going through old age. We need more of that in our society, not less, as we're becoming an aging society. So I'll stop there, and my email address